Osteoarthritis is a word which is derived from two Greek words. Osteo means bone and arth means joint, and itis means inflammation. So basically, and it's a degenerative disorder of the joint and the bone, where subchondral bone and the cartilage between the joints that gets slowly degenerated and destroyed. That's what osteoarthritis is, and basically what it does is, because it starts from those joints first which are mostly bearing a lot of mechanical stress, like the knees, the hip, unfortunately mobility is affected. So that's what osteoarthritis does, and it stops a person from or restricts a person from performing his daily activities, because when it reaches the small joints of the hands, it can be a major impediment into day-to-day life. Well, the modern lifestyle, of course, puts almost everyone, all of us, into a greater risk. Obesity is becoming a huge, big problem. So whenever you are overweight, there is more mechanical stress on your joints. So greater is the chance of you having, your weight-bearing joints getting involved. Genetics plays also a major role in this, and not exercising, not keeping your joints mobile, and not keeping your muscles in good tone. All of these factors are, of course, additive, and there are many other lifestyle factors which are involved in this. Well, the major symptoms are, of course, pain, stiffness, and swelling. Morning swelling, morning stiffness comes a lot of times. Then there is a lot of pain. There can be swelling around the joints. So these are the most common thing. And then stiffness, not being able to move around easily. The range of movement reduces considerably in most osteoarthritic patients, and this is how we recognize it. Per se osteoarthritis, what I do in my practice is I tend to reduce all the risk factors involved in this. We tend to give in the initial stages a few anti-inflammatories, which as I had explained earlier, that because inflammation plays a major role in arthritis, we tend to reduce the inflammation, we tend to reduce the swelling that is around the joint. And then finally, we of course do some physiotherapy and rehab exercises. And now, of course, thankfully, there are a lot of medicines which promote cartilage regeneration and subchondral destruction of the bone that can be regenerated to some extent. So I think all these factors, when we involve in therapy, they all bring out a good result. The most common symptoms, of course, are pain, stiffness, and swelling. And there's a major restriction in the range of movement of the joints, and that's how a clinician would generally recognize it to be a start of osteoarthritis. Well, it depends from surgeon to surgeon, and the kind of surgery which is done. Happily now, with ceramic joints, with new age therapies and involved, not only is the convalescence period been shortened, but I think the pain-free time is safely anywhere between 12 to 20 years. So of course, every center has their own success rates, but this is what generally it is. There are many different implants. Currently that I would recommend, of course, are the ceramic ones which are going around, and of course a lot of surgeons now, we are doing 3D printer outputs, which are a computerized reprogramming of the joint, which looks just like the original joint. So I think a lot of progress is being made in that ground. Your hospital stay would generally last between 5 to 7 days. The first weight bearing, I generally allow my patients to do that on the 6th, 7th day, but one can expect to walk well in about 3 weeks' time. Oh, 3 weeks is something that I tell my patients sometimes, and most of them do that by that time. I have known patients to do that earlier as well. And the last that I have ever seen a patient do is after 4 weeks. Osteoporosis is a major loss of bone mass. Whenever the bone has lost its major tissue, we begin to call it osteopenia. Minor amounts we call it osteopenia, and when it loses a major amount, then we call it osteoporosis. Well, it's a big issue. I think a major part of what we do involves osteopenia and osteoporosis. So, one of the bigger contributory causes is vitamin D deficiency. And vitamin deficiency is not just related to health of your bones; it's related to general health and well-being of the human being. So, I always recommend a healthy exposure to sun. Each day, 15 minutes of sun exposure each day is a great idea. And all vitamin supplements and all will never be able to contain a sufficient and the right amounts of vitamin D which the sunlight can do. So that's something that I would recommend as number one. And number two, keeping your height weight ratio in mind. One should never let your weight go out of hand, because once it does, it's a gigantic task to bring it back. And thirdly, which again is as important, to keep your muscles and your joints in a good tone. So a good bit of exercises each day is the only thing that you can possibly do. Oh, just healthy calisthenics. Just start with a morning walk, warm yourself up, do a bit of yoga. I think there is no set one exercise which will ever be sufficient enough. So playing a game of squash or tennis, or doing a 10-15 minutes of swimming, cycling, a healthy lifestyle. I don't think we should be all fanatics going and hitting the gym for hours and hours like I see some people do. A healthy mix of all activities, including household work, and men must follow that, I think is a must, and it's enough. I would all I could say is that the modern lifestyle has taken its toll on our health and on our bone health. So I think remaining outdoors, outdoor activities, encouraging walks, encouraging activity during the day, that's possibly the only thing I could suggest. Osteoporosis, we give, if it is a severe one, we give vitamin D injections. Otherwise, there is a lot of oral preparations available as well. Cholecalciferol is a great choice, and depending on the kind of training the doctor has, I think some people start with a low dose and keep giving it for a long time. Some people like to just give a huge big vitamin D shot, use it as a depot, and no maintenance is required after that. So many choices are there.